effective mucus clearance is absolutely essential to reduce symptoms and optimize treatment in cystic fibrosis, particularly during pulmonary exacerbation. And there is already a number of airway clearance techniques that have been used in patients. And we always very, very welcoming and trying with new hopes, new and modified approaches to chest physiotherapy, which are being investigated in order even more increase the effectiveness, tolerability, and safety of the treatment. And assessment of the benefits of these new approaches is based on improvement in clinical parameters and lung function. And everybody here is aware what is chest physio, what are the main purposes of that. We need to change the structure of the mucus and finally eliminate it by expectoration. So here there is our new airway clearance device, which uses a pneumatic vibratory stimulus which has been developed and is based on rheological and exotropic property of the mucus, and it spreads a vibratory pneumatic signal in the bronchi tree during relaxed exhalation by disseminating a successive pulses. Successful because it was a constant negative pressure causing collapse. So it's with these very short negative pressure pulses, we're getting the effect we want. And this device is designed to modify mucus viscosity and elasticity, mobilizing, transporting to finish with expectoration, exactly what we want. And probably a lot of you is already familiar how it looks. And our primary aim of the study was to evaluate the efficacy of Simeox technology in patients with cystic fibrosis, and secondary to examine its safety, tolerability, quality of life, and patient satisfaction. Patients aged 10 to 18 who are under care of our center and were admitted to hospital and requiring IV antibiotic due to pulmonary exacerbation were allocated consecutively to Simeox arm or usual chest physiotherapy arm without Simeox. They performed spirometry and multiple breath nitrogen washout for lung clearance index assessment on admission and prior to discharge after a 2-week hospitalization period. There is our lung function lab where we performed with mentioned equipment, spirometry, and LCI index with MBV. Pulmonary exacerbation, according to Fuchs criteria, were assessed, and both questionnaires, patient assessment of Simeox and cystic fibrosis questionnaire revised, as well as genotype, nutritional status, microbiological status, were from their history of disease. Lung function test performed, this spirometry, and multiple breath washout. There's patients' characteristic of patients' group, including study group and control group. And here they are results. And I mentioned pulmonary function tests were performed, and there is FEV1, which are changes in Simeox, that means study group, and control group. In both groups, it was improved, but without statistical difference between the groups. And this is parameter which was especially interesting. That means maximum expiratory flow at 25% of forced vital capacity, MIF25. It was statistically different in patients with Simeox device, so significantly better. And results LCI, in both cases, they improved. I would like to remind those who are not using it on everyday practice that the lower results, the better with LCI index. The other things which were assessed is patient satisfaction. As we always talking during our session, it's very, very important to have something which patient would accept for chronic use, and especially if it's physiotherapy device, because we know it's very time-consuming, lifelong for patients with cystic fibrosis. And here they are, results of the questionnaire. On the first graph, how easy was to use, and 66% say it's very easy. I wouldn't say so. It's not very easy, but it's possible to train it. And how long did you train? And still over 30% thinks very short time, but 45 a bit longer, and it's a scale from 1 to 4. How long do you think you need to train how to use the device? And the results number 4 is about how comfortable you were using that device, and the scale of comfort, 66% were feeling very comfortable. And was it well tolerated by you? Yes, most of them, 75%, thinks it was very well tolerated. Could you use on your own the technique? 83% thinks yes. Would you like to use the technique at home? And it's more than half patients would like to use it at home. Would you advise this? 100% would advise to somebody else. That's interesting. So somehow they wanted to advise to their colleagues. And do you prefer to use Simeox than what you were doing before? And then still more than 60% did prefer. So summarizing results, in this group of 48 patients, 24 treated with Simeox and 24 using chest physiotherapy. In both groups, spirometry parameters increased significantly after IV antibiotic therapy. Significant improvement in MEP25 was observed only in patients treated with Simeox, which I underlined on the graphs. A similar trend was observed towards lowering LCI ratio in both. Drainage with Simeox was not painful for any of the patients. About 80% of them did not feel any fatigue. All patients felt comfortable, and over 80% learned quickly the use of the new airway clearance technique. No side effects was observed for each therapy. After training, 91% of patients thought that they could use Simeox device on their own, and 87% stated that they would like to use it at home. Overall, 62% of patients preferred Simeox device over usual chest physiotherapy, and all said that they would recommend the device to other patients. Well, concluding, spirometry parameters are increased significantly with cystic fibrosis patients treated for PECs with IV antibiotic therapy and intensive chest physiotherapy. Simeox improves the drainage of the central and peripheral airways. This new airway clearance technique is safe, well-tolerated method of chest physiotherapy and can be considered an option in treatment of pulmonary exacerbation. And very good news is that that study will be published very soon in Journal of Mother and Child, GMC journal available on PubMed. And acknowledging all the patients and their families taking part in the study, I would like to acknowledge study team members who also co-authors of that work. And I would like to tell that we currently working on randomized study in stable patients on a group of 40 patients. It's a bit delayed by obvious reason of COVID intervals. It's a bit different work, but we keep doing that study. So hopefully soon we will be able to conclude that stable status study of Simeox in CF patients. And I would like to thank you very much for your attention. And there is a view of our hospital. On the left is our Cystic Fibrosis Center, where we performed all the study and taking care of about 400 patients. And as you know, as you see, there is a nice forest around it, so we're trying to keep away any COVID-19. So thank you for your attention.